Hearing none, all those in favor say aye.
Aye.
Opposed, same sign. Motion carries. The next item is for the January 18th minutes. Have any discussion or a motion?
I'd like to move to accept the January 18th, 2023 minutes as written, please.
I'll second.
Motion is second. Any further discussion?
Just to clarify first, this would be the amended ones that were sent out yesterday or today. Okay, and perhaps one tiny clarification I thought, where it says Dr. Marker introduced the new member. Could we just list her name, Kristen Woodson? That way we don't have to go to past meetings to figure out which one it was. That is my only amendment.
Would,
I'd like to
recommend your-
rescind.
your-
I would like to accept, I move to accept the amendment to the motion to accept January 18th minutes as amended, including in section 4, identifying the new member as Kristen Vincent, certified commercial employee.
I'll second.
We have a motion and a second. Any further discussion? All those in favor say aye. Opposed, same sign. Motion carried. All right. Next item on the agenda is board president announcement. Got a few things, but one, I think we should do introduction. So we have Dr. Rob Hayes, new member. Would you please give us just a brief kind of bio, and then maybe after he speaks, we can just call it introduce ourselves.
Sure. Okay. Rob Hayes, born and raised in this area, actually born at St. Joseph back when it was at 4th Street. Grew up here, went to IU for undergrad and then IU for med school. So back here for residency and now back here to hopefully serve, do some good things.
Okay, great. Thanks for agreeing to be on the board. We'll go around the table real quick with the introduction.
Okay, do we just want name?
Name, kind of.
Okay, Ellen Higgin or Ellen Rylander now. It has been for 15 years, my goodness. Ellen Rylander, I am a attorney, went to Notre Dame Law School. Currently, I am also a homeschooling mother. So, and those diverse parts of my life, I guess the commissioners thought that it made me a good representative of the general public on the board. So that's the role I serve.
I'm John Litt. I'm an engineer, civil engineer. I've been involved in the environmental health arena for 30 some years from this area, born and raised in this area.
I'm Heidi Beidinger. I'm a faculty member over at the University of Notre Dame. I've served on this board for about 8 years. In the recent past, actually, it's like I was president 2 persons ago. And then I have been in the field of public health for 30+ years.
I'm Mark Fox. I'm the deputy health officer.
Kristen Vincent, I've been a nurse midwife for 22 years. I've owned my own practice for 8 years. I do primary health care for women and have been helping serve this community for a long time as a nurse prior to a midwife. So, and I have 2 grown boys and 2 grandbabies.
Awesome. Marcel Levin, I'm the attorney for the.
Michelle McLeory, I'm a family doc. I have been in town since 1988, doing family medicine.
Thank you all. The other thing I wanted to mention real quick is a big thank you to Dr. Marker. He was a joy to serve with and he'll be missed, but hopefully we'll see him in the future in some capacity to help with the public health of the county. I know he's passionate about that. As we're all aware, Dr. Einkerns resigned back in December. And just on behalf of the board, we recognize that and accept that somewhat begrudgingly, but that's obviously his call. So one of our major tasks here is to find a health officer replacement. With those of us that have been around, we know that's a daunting task. So that the personnel committee will take up the lead on that, and it'll probably be very intensive for the next few months and take up a lot of the board's capacity. The final item I wanted to mention is on the governor's report on public health. We wanted to kind of dig into that at the same time as we were looking for a new health officer, but given the recent events and Dr. Marker's departure. That slowed down a little bit, but I would like to get that on the agenda for the March meeting. And maybe if all the board members could review that report, and then I don't know if Dr. Einturns will be here or not, but it'd be great to get his input on that as well. And then hopefully that still gives us time to make any comments to the legislature that might be impactful. That's all I have. Next item on the agenda is the health officer's presentation and report. Dr. Fox, I assume you're.
Yeah, I'm
that.
filling in for Dr. Einters, who's on a little PTO right now, so you have the report in front of you. Couple things just to point out, then I'll take questions. Some of the, unfortunately, some of the tables, especially in the public health nursing section, I see there's some tables that are labeled as year-to-date over prior years, 2019 to 2022, when it appears that those are cumulative numbers for those years and year-to-date for 2023. So if you see a wild discrepancy and, for instance, directly observed therapies for tuberculosis on page 39, it says year-to-date 2022 is 1,418, year-to-date for 2023 is 26. I think that was a cumulative number for prior calendar years. So sorry that edit didn't get caught in before it got distributed. And then I think the only other kind of change in appearance really is there's a little more detail about some of the activity from the community health workers in the HEED report. And just to provide a little more granular insight into their activities over the last several months. So I'd be happy to entertain any questions from the board.
Any board members have any questions or comments?
I do, John.
Yes.
Could you give us an update on vector funding? So there was a county council meeting where they discussed vector funding, and then I wondered if we could get an update on some funding for the FEMA that was also discussed at the county council meeting. If you could tell us what's up with that.
So I know there were discussions with Dr. Einters and the anonymous donor for the Vector program. I was not included in that communication. I don't know, Mark, if you know, the donor wished to remain anonymous, and I don't know that they've changed that stance, but
That's true. They're still anonymous. The funding that we received, it was several years ago, $25,000 donation. We used about 11,000 of that, and that money was being held in reserve in case we had an outbreak and needed to do some aerial spraying or, triple E like we had a couple of years ago. So now the Vector there's a line item in the budget, so Vector is completely funded every year. It's just that we're holding that money in reserve in case there's an emergency. But I guess they're working it out.
It's being held in reserve,
But
but we can't access it right
yeah,
now.
it's in our, it's money that we have in case we need to access it.
But no, we cannot access it right now because it's been held in committee.
Okay, so I guess I'm asking the question, why is that money being held up? Like, why can't we access it?
because the council wouldn't allow it to be appropriated with the anonymous donor, even though over the last several years, that condition was accepted by the council and the commissioners, but
Is that legal?
For them not to accept.
An anonymous donation?
Anonymous
Is that-
donations are legal, yes. Not accepting is also legal. Everything's legal.
Okay, I was just asking the question. It's odd. I mean, I've been on the board for 8 years. I've never heard of this happening before, so,
There's a statute that allows anonymous donation.
okay.
I remember that came up when that donation was first received, and I think in the meeting.
I wasn't
someone-
here when that was first received.
Yes, you are, because
4
you,
years ago.
Yeah. It was
2020.
well, I know the issue about an anonymous donation came up in a board meeting, and someone in fact, it may have been Ellen's very first board meeting, if I remember right, because we were in council chambers, a question came up. Could we receive an anonymous donation? And you had said yes, but that's the current holdup, so we can't act on that because it's being held in committee. And then
Is there a time frame on when this will be resolved?
At the next council committee meeting, which is February 28th, they can decide to move it forward or just hold it.
So I don't mean to be daft, but what's wrong with an anonymous donation? I don't understand.
Marcel, any insight on that?
No, like I said, you can accept them under the statute. It's a question for the council. I don't know. I don't know what their issue is. I've not attended the meetings,
But then-
so I try not to go to the council meetings so I can avoid it again.
Maybe we, yeah, so, I mean, maybe somebody from the board has to go to the council meeting to ask the question, to understand it.
Mosquitoes are a public.
Mhm.
Right now, you're saying that's in reserve, though. We don't have a current need for that money, correct?
Yeah, there's no threat of mosquitoes right now, so.
We're using the money in a budget to take care of the vector problem. So that is as reserve money to be held, you know, I imagine.
But it's on hold. We can't act, is that correct? We
Yeah.
can't
Right,
access it
correct.
till
If
it's.
if an emergency arises, we don't have access to those funds because it's being held in.
Yeah, I imagine if we had an emergency, I would hope and think that there would be a change of thought on using the money. Do you know what I'm saying? Like, I don't
Right,
know.
so I guess I
That's
would
not
like
our
to,
call, but
I guess I would like to get an answer on that before an emergency happens, right? So, right, so that we're made whole and that we don't have money hanging out there. So, but perhaps we need to
I'll be happy to
go
reach
to
out.
a council meeting or so, or reach out
I'll
and
reach out
find
to
out.
the committee chair and or go to the meeting.
Okay.
See if I can figure out what their issue is.
Yeah, I mean, sometimes it's equine encephalitis is a real issue in this area, southwest Michigan, northern Indiana, and Elkhart and St. Joe County. I mean, we see it in patients.
Yep. Okay.
People can.
and
die
Lyme
from it.
disease has tripled
Yeah.
in the last 3 years,
Right.
every single year. So that's a big problem. I see that in healthcare. I'm sure y'all do too. Of people that are sick. So,
I think the other thing is because the appropriations process takes 2 months before we can act on it. You know, we don't want to get to July
Yeah.
and then be making a request. So
You usually start seeing it in July and August. So.
do we have enough money in the budget for vectors though, that we've been able to control this in the past? Like,
Yeah.
you know what I'm saying?
Well, yeah, so we were gifted the 25,000. We used part of it, but then that first year, but then after that, that money was added to the budget, so we didn't need to use what we had. So now from every year forward, we've had money in the budget for it. And we have money in the budget this year also. So we could cover,
Yeah, I just.
we
wanna
can cover
make
most
sure.
of our activity and our spray with what we have budgeted now. It's just, this is just held in reserve in case of.
And then Heidi, back to your original question, you know, the money for FEMA that was not anonymous donations that were received to support the Achieving Birth Equity Conference. There's money left over for that that's intended to support a lot of the community outreach initiatives for pregnant and parenting moms and the health cafes, the work of Sally and the community health workers. And that was held up in the council meeting for reasons that are not entirely good. At least appears to be at least some level of misunderstanding or misrepresentation about the extent to which the National Birth Equity Collaborative is involved locally in those activities, but the activities that are planned, that the balance of these donations are intended to support are wholly done by Sally and the community health workers. I mean, it's entirely the activity of the local health department. NBEC is not involved in that activity. And so it's intended to support pregnant and parenting mothers and addressing concerns intended to reduce pregnancy and infant loss.
And did we have an indication when this part is going to be resolved?
I don't know, Sally, if you have any more sense of that. This just happened last night, so I don't.
I sent an email to the council members explaining what we've been doing. I had shared emails with Councilwoman Drake and shared some back and forth with her today about details of the distinction between the work with the National Birth Equity Collaborative and then what we're doing with the funds that were donated by community partners. That's the money that's in question. So no, I don't know. Some of the questions were that not understanding what we're doing with money. And I guess I was gonna say this in public comment, but I will say it now, that every month in the health officer's report, there is a description of all of the activities we are doing with our work groups related to funds. And so that information is available. I'm available to talk to everyone about that. So it's my opinion. That information is available. Instead, that last night, that funds were used to, make a statement about a speaker, which is also in this board. Last year, there was objection to some of the messaging, and that's fine, but that was April of last year. And the funds we've been using all year. It was appropriated last year. It's the balance. And some of the money also is from stipends when I speak here in town, and stipends are given for my speaking. That money is going in there because often I'm invited to speak about what we're doing to achieve birth equity. Which if anyone doesn't know what that is, it is it's the assurance of the conditions for optimal births for all people with the willingness to focus on racial, ethnic, and socioeconomic disparities. And so that is the focus of what we're doing because of the higher rate of mortality for Black infants.
Well, since you brought up the National Birth Equity Collaborative, can you tell us more about the assessment and work plan and the status of it? You said that it's scheduled for completion in a month.
At the end of March. And so I'm going to go way back. So back in, this would have been 2019, the FEMA program through the review of cases and identifying the disparities in one of our community action updates stated that racism and systems and bias were contributing to the disparity. And so in order to address that work, we contacted, and so that's, that was our finding, that was one of the factors contributing to the disparity. So we contacted the National Birth Equity Collaborative because we learned through conferences that they were experts in this, and at the time they were offering an assessment, which means this. If you're going to work, and we're going to work on eliminating disparities, we have to assess our own work and that of our community and our community partners. So what all of this has included is looking at our reports, seeing the work that we've produced over the last, several years, interviews with leadership here at the health department, interviews with leadership at our health systems, and all the people that participate in all the different initiatives we do for moms and babies. So there's been staff surveys, interviews, all of that information will come together. Normally, as part of that project, they would do community-based focus groups with moms. But we were already interested in doing that. That was one of our goals from our birth equity work group. So we decided to take that on ourselves, which is what we've been doing through these cafes. And what the cafes are is we meet at libraries, or we have a couple scheduled at Women's Care Center next week, which are in question now because of funding. We provide refreshments and gift cards for people's time. And we talk about what it's like to be pregnant in our community. What's it like to work? What's it like to get a doctor's appointment, to get insurance, and all with getting the input from the people affected the most as to what we could be doing differently.
So are you sending the information that you gathered from these
Yes.
cafes back to the
So we will,
NDEC?
yeah, so we will share that those results, the data from that, just to be incorporated into the report. And so when this report comes, it'll have information about what were the views of, community partners about birth equity, or what the role of the health department is in eliminating those. And so it'll be a report and assessment that we couldn't really do as the people seeking that information. And then we will decide how to act on that or not, or, so nobody's telling us what to do. It's just like having a consultant ask these questions, but through the lens of achieving birth equity. It's unacceptable that we have this difference in the rate. And so, but for our purposes of those cafes, we want to listen to what mothers are saying. That's the most important thing to do. Like we shouldn't create new programming and say, well, this is what people work. But we want to get their input. And so some of the things that they're telling us are, it's too long to wait 4 to 6 weeks to see a doctor after having a baby. We're taking the baby out of it to know it's caring for us. We would like more time and appointments to learn about pregnancy. Not everybody knows about, when do you learn about that? So all kinds of information. They love support groups and things like that. So, we're not using a ton of the funding for those. We hope, but that funding will help be like the seed money when we figure out what to do next based on all of that information. So that's what it is. But so it's kind of like two separate things. We're doing that. We would be doing this anyway, these cafes, but it will help be part of that final report.
So when the report's done, does the relationship with the NBEC end, or do you
Yes.
continue
No,
interacting?
that's it. So when we started this, and it was partly during COVID, so that's why it's kind of taken a little longer than initially anticipated. That was funded. That work was funded by the Community Foundation of St. Joseph County and Indiana Minority Health Coalition. So specifically for this assessment. And so when that, what's the word, deliverables? When we receive that, that's it.
Do they then give you a report back though?
We'll get that report. Yeah.
So so the end of March, right?
That's
You'll
it.
give them the information and then they will send you back a recommendation report based on
So
your information you sent them.
correct. So all the work they've been doing the last at least year or more with interviews with community partners and all of that will be, which of course will be shareable with everybody.
Will they send you like the work product, like the copies of the interviews and the data, like the collected to use?
I'm not sure.
How did you guys invite people to these work groups then? Like how was the word given to the community for the cafe?
Okay, so we had flyers so the first few were like libraries and the community centers. So we did even door-to-door canvassing around the neighborhoods where we had them. Then community partners who serve moms and babies distributed them. What else did we do? Community health workers.
Some of our
distributed
social media,
them.
we did
Social media, yeah. So I mean, it was open.
So
to
with the
anybody.
wide demographic of people that you all show up, do you feel like you got a good sample
So far we have.
of the people you were trying to reach?
So far, we've talked to 35 women, which is actually really good over the first few. And then, like I said, we're scheduling more. And so we do have a preliminary PowerPoint. I shared it at the community action meeting that we had. You guys all got an invitation. It was January 27th. I actually shared the preliminary slides from that. So it's not all, one type of person. There is, some diversity there. And so now, instead of just having it generally at community places, we're like, let's go to where people are. So we're looking at having a women's care center. This is already agreed upon. La Casa, St. Margaret's House, YWCA. Yeah,
And that's what you need this money for,
right.
for the
Doing
follow-up.
that. Yeah, right, because we want to be able to, when you're doing this, people are giving their time, you want to get cards, you want to have refreshments and make it, a nice event for people. And so, and most grants, to be honest, you can't buy food with grants. So this is nice, unrestricted money donated by all of our community partners that supported the conference.
Do you guys have a budget money set aside for your use as well? Like, Is this the only way you're
That's
getting
the
your
only
money?
way to do this. We would have to get other donations because like the grant for what I do, like generally like FEMA in case that's separate.
Yeah. So we don't have a budget, we don't have anything set in the budget for community outreach for improving infant and maternal.
I mean, like we do that, but not this very specific way, because we don't have funds to just, create an event and so, I mean, we're not spending that much money doing that, but the idea is this money then eventually could be like, let's say there's $5,000, you can use that as a seed money when you apply for grants to say like, this is what we've done all this work with our community and this is what they're saying and here's what we'd like to do. Here's the money we can put toward that. You know what I
Do
mean?
you guys fall under the nursing budget then? Is that what you?
So the FEMA is all under a grant, safety pin grants in the state.
So we don't have any money in the budget for your program?
Not in the county budget.
So not for that program, not for the cafes. But right, but you're right, it's not in county budget at all. It's all funded through the state and other grants. Right. Sorry, that was a lot.
So I bring this up for two reasons, John, and it ties into the vector money that's being held up. And so now we've got the birth equity money that's also being held up. And I'm concerned because two reasons. One is I'm a faculty member at Notre Dame that came out of my department that donated to that. And I'm wondering why in the world the county council is not releasing that money to continue this good work, right?
Okay.
So that's number one. The second thing is that I'm very concerned about that county council person who has now written 2 articles in the Federalist who is denouncing public health. And this is the same person who then is saying these things in the county council meeting that are misconceptions. And it feels like intentional lies.
That's pretty.
Yes, it is. I don't need caution. I understand what I'm saying. This is all in the public domain. Everything that Sally said, how many times how many times have we heard Sally tell that story? A dozen times. So all of this information has been in the public domain. To say that we don't understand what's going on is unacceptable. It's unacceptable. So my hope is that in our role as Board of Health members, our number one job, aside from hiring a health officer, is advocacy. So what do we do as advocates of public health to fix this? So that we have a county council that supports public health and supports the Department of Health and gives it the respect and dignity that it deserves.
Like I said, I will go to committee meetings and try and find out what the issue is and try to get it cleared up. I don't think it helps to call county council people liars. That doesn't help our advocacy at all, so.
Well, there's a violation of the board statement for conduct of public meeting.
Fine, I will retract my comment, then I will just say misinformation is being shared and is being said in county council meetings.
I have a question about. So grants in general, or not grants, donations in general. I don't understand why a donation in general is not, whoever you donate it to, it doesn't stay in their control. Like, why is that a budgetary? Why is that? Why is that part of any other control than whoever, like if somebody gives me a grant for something to do with what I do in my office. I don't get that, I guess, like,
So
explain that to me legally.
okay, so under state law, if someone wants to donate money or give a grant, then it comes to the board approves it, and then it goes to the county council for approval. Extreme examples be if a hate group were to give money to fund something that the board would disagree with because it was clearly motivated by outright hate for a segment of the population. I would hope that the board would not accept the grant, would not accept the money, right? So just because someone wants to give you money, you don't have to accept it. We're not
Right. And
necessarily.
if we accept it, which you would, I would hope we would not be accepting hate money. But if you accept it, so why is there legally a issue with any other say,
You're
I
not-
guess,
so
in
the
the,
fiscal
like,
body
in
for the
the,
county is the council. So the council has ultimate say in acceptance of all funds and the disbursement.
Even donations.
That's state law, and you don't, well, because once
Oh.
again, if you donate something for a purpose that's not what the board would accept, not what the council would accept, the council does not have to take that, right? You don't, if you donate something for a cause that's not something that the council wants, not something the board wants, they don't have to take it.
But even if the board wants it, the council can say no
The council is the ultimate
for donation.
for fiscal body for the county, for all money for the county.
Oh. that's interesting.
No,
And while we're on that topic, I just want to set the record straight because I misremembered earlier. We had two prior anonymous donations. The Vector one was before your time. There was another one to support the data strategist.
Yes.
And that was
That was
discussed at
the
Ellen's
That was
first
the-
board meeting. And the question was, can we accept an anonymous donation? So
Yeah.
I misremembered
You still
that.
can.
But it doesn't matter if we accept it, honestly. It only matters if the
Right,
council.
we don't have
It
the
doesn't matter if
authority
you
to
accept
spend
it.
it.
Right.
If you don't accept it, it's a two-step process. It doesn't matter if you accept it, because if you don't, it's dead.
Yeah,
So you have to accept it and then they have to accept it.
but these grants haven't been coming through the board.
They've not,
Why is that?
I don't know.
Are they supposed to?
Yeah,
Yeah, statutorily they're supposed to.
that's why I would think they would go to the
What
board.
grants are not coming through the board?
That would be the
Any
same.
grants that are coming to the council and commissioners for approval. Are supposed to come through us at some point.
The ones that originate here at the Department of Health.
Uh-huh.
Yeah, I mean, we're notified when they're applying for grants.
That's not what we're supposed to do statutorily. We're supposed to.
supposed to approve them.
Oh, well,
So that'll be something we
Going
can,
forward,
yeah.
just need a motion to approve those applications, I guess.
So if we want to do grants, which I very much want to do, then. But I don't want to waste a lot of time doing grants that aren't going to get approved. Is it possible to get like a tentative approval to apply for a grant and then also go to the commissioners and you know, all the money control people and say, can we do this?
absolutely.
Okay, because
Kristen, but understand that even after you get the grant, so you get that pre-approval, right? To go ahead and go do that. Once you receive the money, it has to go back through an approval system to say, okay, yes, you got the money, great. But you have to get that second approval from
Right.
them. And they can say no, and they did do that to us last year on a $3 million grant.
once they said, go ahead. and
They
get
said
the-
yes,
They
and then
gave us
we
permission
received
to
the
apply
money.
For it.
and
And then
then
once the money was, once the grant was awarded, they,
But there was change in staff probably, right? Different people said yes.
No,
Well,
That
I think,
wasn't-
I think that grant that you're talking about, the commissioners didn't approve it, but then the council overrode it.
right, they vetoed the
Yes, there was
commissioners.
absolutely.
I'm just trying to figure out if there's a way,
Yeah.
like, not,
One person at a time, please.
I'm just trying to figure out if there's a way that we can change the way things are set up, that we can. And maybe, and I have no clue if this is possible, but it's like, can we get some kind of authorization that cuts out now we're gonna go and back and reapprove it? Like, if you approve that we can get the money, if we are awarded the money, can't there be approved already, because
no,
we
there
already
still
asked
has to be
that?
an appropriation process and that's the council has that authority.
But don't they have that authority in the beginning to say not to even do the grant?
Not that I'm
Not
fine.
council.
They don't make an
They have the money
appropriation
for the
until they have the
grant.
money.
Right.
And there's no way to do that ahead of time. Do you know what I'm saying? Like, grants take so much time,
lot of work.
so much time. So, yeah,
And the appropriations process takes 2 months. So if we get a grant today, we have the budget all lined out, we know exactly what we want to do. It goes through the council committee and the council and the commissioners before we can spend a dime.
but have you guys gone to them ahead of time and asked them if you could apply for this
Yes.
grant?
We have to get commissioner's approval to even apply for the grant.
But
The
not the
council does
council.
not come into play until it's appropriation time after we've been
And there's
awarded the grant.
no way to fix that. There's no way to say, can we go to the council? You know what I'm saying? No, I'm just saying.
It still wouldn't change the process.
That's what I'm wondering. It's like, how do we, is there any possibility to change that process where we're like, can we ask them through and then do it?
You can
But it
have
sounds like it's a state.
more
statute.
communication with the council
It's a state.
before you apply for the grant.
There's state
To
legal
line
procedure.
up support.
That's just.
Yeah.
You can also identify the uses that you want to put the grant to. So if you do all of that, then I would hope that
But that's like law, you're saying, there's no
that
change.
is
in
state
it.
law. That's not the county. That's state law.
Somebody does need one.
That's why I said run for office. Run for state office,
Okay.
state laws.
Any other comments or questions on the health officer's report?
Actually, one small thing that still relates to the FEMA stuff, the community action update.
Yeah.
It mentioned slides for the presentation are attached. I don't know if I got any. Or,
They weren't attached. Well, I attach it right here. Oh,
Oh.
okay, I was gonna say, 'cause I attach them for the health officer, so I don't know. if it
oh,
makes it
okay.
clear to-
Could you send them to us? Would you mind?
Oh.
Thank you, thank you. Oh, one question that I've had for a while, that I keep forgetting to ask, cases, the things that they're doing, there's, oh, I'm sorry, page 34.
Thank you.
Where they have positive childhood experiences data. I've noticed this in past months, and I get to ask about it. It sounds like they're only gathering data in experiences, the school-based surveys, they're only gathering it in South Bend Community Schools. Is there a reason why it's just South Bend Community Schools and not the other school districts in the area?
That's the pilot data, and we're trying to get the other school districts. We're trying to expand it within South Bend Community Schools and extend it to other school districts. But,
Okay, is this grant funded too? Is this whole program grant funded, or is it in the county budget?
that particular survey for the school-based activity is just a function of the department. It's not funded by a separate grant. There are some other aspects of the work that are with suicide and overdose and ACEs and PACEs that have some grant support, but this particular survey activity is just an activity of the department.
Okay.
But we have been trying mightily to get it expanded across the schools within South Bend and other school districts.
And you're meeting resistance from the administration of the schools?
There's support expressed, but it's slow to get traction, just because it's more work for them and for teachers, although we do most of the work. It's really distributing a 10-minute survey. So, but yeah, we're continuing to work with the districts to see how we can extend this work.
And you said this includes like suicide and
There are other activities that Robin and Frank Spacia, who's our PACES coordinator, are involved in that have some grant funding for their activities that kind of triangulate suicide, substance use, and PACES work.
and that's like surveys and stuff as well, or no?
No, that's more intervention oriented.
You talked about a positive childhood experiences school guide. What is that? What is that about? Is that something that is given to families and students? Is that for schools? It just says PCE.
Yeah,
School
so,
guide was completed.
our
It's on page 30.
efforts in PACES have been focused on getting a handle on what the experience of especially middle and high school age students is. And the focus, especially on positive childhood experiences. For instance, one of the things is, having essentially two trusted adults in your life. And so one of the resource guide is really intended for both youth serving organizations and for schools to think about how do we enhance those experiences and try to protect kids who are at risk of falling through those cracks. And so there's been an effort to collaborate with a lot of the mentoring organizations in town that focus on PACES and resilience and things. So we're not asking schools to do all the heavy lifting in terms of how do we intervene and improve these circumstances, but really trying to build some collaboration there to help serve the most at-risk kids.
Is this the sort of thing you could put on the website or just on the health website, health board web, or health department website for general use?
Yeah.
Oh, I had one other question. You're talking about, social needs assessments. You received 79 social needs assessments, and, you're also talking about, some of them online. I actually did look to see I looked online and saw the online form. I'm just curious, what percentage of these 79 social needs assessments or any monthly group of social needs assessments tend to come from people going online and filling out the assessment versus you going out in the community and getting the assessments filled out that way?
Yeah,
Have a ballpark figure?
no, but I can give you a general idea of like. We get, let's see, I think 16 last month from La Casa de Amistad. We have CHWs who go there, for instance, who are working alongside La Casa to ensure that people there can get access to health insurance, as well as like benefits as they need them, or being routed in with community organizations that need assistance. So if you need food, La Casa does not provide food, so they would connect them to a food pantry. So embedding ourselves into that organization has helped. Our CHWs do door-to-door canvassing. It depends on the time of year, really, how many they're gonna get from door to door. Like, I don't open the door that often in the winter, right? But they also engage a lot with the businesses. And so it's a lot of the built-in partnerships that they've established, being with businesses, going and building relationships with the libraries where people then walk into them. The online process of it is, that's kind of twofold. The external form, the one that you would see, they can fill that out with somebody in the moment, or they can do it internally. So it just depends. We did get an increase recently. The city of South Bend reached out to us and said, hey, we have to stop our funding for emergency housing for the rental assistance program because it ended this year. And so can you help assist people finding housing? We can try. Housing is the hardest thing to find in this community, but yes, we can probably help find things like utility assistance and things like that. And so they sent over quite a few people and they gave us the link for our external form in that scenario. But usually it's the people that they are meeting in those moments. Those are the folks who are filling out the form.
So the form is, I mean, you'll find the form online and anybody could in theory, like go to the health department website and fill it out. But most of the people filling it out are people who met with a community health worker, and the community health worker is filling it out for them or helping them fill it out?
No, they fill it out. The community health worker, depending on literacy issues. So if they have a literacy or issue, they might sit down and say like what each part means. Like, what do you mean by, do I have health insurance? Like, that is a question that seems pretty simple, but there's different types of insurance, right? So they might explain there are different types. Which type do you have? Do you know who your primary care physician is? They'll help work through that. But the community members are filling it out. And I'd like to kind of just say that these social needs assessments, we hope to get more as people know about our program. So I went to the police 6 times, took a roll call and presented on our program. At that time, no one had heard of our community health worker program. From all of the police officers, I did 6 roll call. I did all of them, right? Except for 1, actually. So the concept of that, they didn't know who we were, but afterwards talking to some of the captains saying, how can I connect a community member right away? Like if I'm doing patrols and I'm seeing somebody who's underneath the bridge, or if I'm seeing somebody who clearly has a need, how do I connect them to you? Do I give them this card? What is the best way? And so as people find out about our program, as large community partners like the South Bend Police or the City of South Bend learn about it, we get more. And so the idea is that as we're going into, we're in year 2, halfway through year 2 of this grant, we hope to continue that. We set up 3 lead testing events just from talking to the South Bend Police. They had connections to daycares and a Success Academy who said, hey, I think my wife or I think my friend might want you to come and provide lead screening. We got to set things up because of those connections. And then through there, we'll talk to the families and say, do you have other needs? Are there any needs that you don't want to talk to maybe like somebody else about? Can we help you? And so that will then build more social needs assessments.
Will you be able to work with other police departments like Mishawaka and
Yeah.
the county, you know,
Yes.
besides South Bend?
Oh, absolutely. So the goal is so I reached out, I asked first to reach out to one. We have some of our CHWs are stationed, as you guys might know, from the maps we've shared, on the southeast side. And on the north side, as violence increases, and specifically those areas, they have concerns. How do we get to know the police officers who are beat cops? And through that, we connected with the South Bend Police, and they're like, well, we don't want to just connect you to those beat cops. Can you come and present this program to us? And so the goal is to continue to present it to the various police departments. I think that it's not location-based. We go to Walkerton, we talk to the police officers there. So the idea is that anybody who could serve this community, we want them to know. It's just capacity. There's one of me, but I want to. So do you know people?
Great. Any other comments?
How long do you have funding for that? Because you have a grant.
So depending on which community health worker program you're talking about. So the CDC, CHWs, they all do SNA, but it's different. They all do them differently.
So like you were just talking about the heat unit.
The CDC ones in particular is who Ellen was asking about, I believe. That should go until August of 2024. Those funds also have to be reappropriated in August of this year. So in theory, we should have a year and a half with our team. And we hope to. We just don't know, as the reappropriations are currently being held up, what that will look like.
I just had a couple of quick questions. Caroline, I noticed you had a lot of trouble with IT in the renewal processes last month. Is that related to the new software, or is that just because we've never purchased the software we need?
It's because not IT itself, but the county-wide program was never executed, and right now we're back to the drawing board looking at new program.
Okay, so hopefully next year that won't be as bad.
The process usually takes longer than $50.
All right, very good. My only other question was on the suicide essence alerts. Is that 6 in 1 month?
Yeah, and you'll see here, so Essence is our surveillance system, that when, that is daily surveillance, when there are 2 points. One day above that, what you would expect based on the algorithm. Then the next day, it's also elevated, it produces an alert to us, and we go in and we see, and then sometimes there actually can be verified where you do see it in higher than average chief complaints for suicide, or suicidal ideation or thoughts of suicide. We also see that chief complaint and ultimately diagnosis can vary, and sometimes things kind of get overlapped. So with this, I purely say, how many alerts were I given? We have a response process for our overdoses, and that's slightly different. Right now, we are working with the state of Indiana on finding the best way to do this with suicide. So, yeah, and it varies. We'll have some months where there's 10 or 8, and then we'll have months where there's none. So all based on that algorithm.
And what are you guys doing with the overdose you said?
Since 2019, we've had an overdose response plan. So when we receive an Essence alert saying that there's a higher than expected number of overdoses presenting to the ER, there's a communication cascade that starts, but it's initiated with me, the Department of Health, saying, this is what we're seeing. Our community partners will report back to me. And we're actually working on a process now, actually the last 6 months, where our community stakeholders, county police, each of the police chiefs for South Bend and Mishawaka, they've been identifying their own trends, since we do see, as we progress, unfortunately, in the epidemic, individuals are less likely to go to the ER. So we'll see our non-fatal overdose ER visits are way down, but overdoses are still occurring. So it's not uncommon for Captain Benicki with St. Joe Police to text me and say, hey, I just responded to 3 overdoses in the last X number of hours. Can you verify? And then I'll go into Essence, and then we have few other mapping tools nationally that we can go in and verify that. And then I send that information to all of my communication cascade. And then do they have enough Narcan? What are they seeing? We need to make sure our harm reduction education is happening. If somebody who's working with people actively using substances, that the likelihood that they may overdose due to a new batch of drugs is likely. And then most importantly, it really is to say, if you come across someone you believe might be overdosing, use Narcan and call emergency services instead of waiting to see what's gonna happen. So that's way more developed than that's what we're trying to, I think, kind of mirror with suicides, just so much harder. So.
And that's operating off a budget or grant as well.
No, none of that is. That's just a function of my role here at the Department of Health.
So it's in the budget.
Yeah, my role is in the budget, yes.
Okay, thank you, Dr. Fox. Next item on the agenda, new business, personnel committee update. The first personnel committee was organized by Dr. Marker, and before the meeting could happen, he was no longer on the board. We went ahead with it anyhow, and then Teresa resigned. So it was the only 2 left on the board is Ellen and myself. We did go ahead and meet, talked in generalities about our approach, did a little brainstorming on who we might know that can help, find candidates. And then we also talked about the job description, making sure that's still what we want to put out there. And
So, again, we need to restaff our personnel committee, which I guess will happen after we talk about this. But I have a kind of a working job description I can give everybody. I didn't want to have an electronic copy out because it's not finalized, and I don't want anybody to accidentally send the wrong copy out. Right one. But also, we don't want to everybody on the board, we want to obviously, you're welcome to see what we have. I think a lot of what we did was, should I just pass this around?
Sure. Yeah.
Okay. A lot of what I did was just, and I might be, Marcel will not get a copy, so I need a copy. Just reference, we added in the administration, tried to add and make sure that there was specific statutory language. That the specific statutory roles of the health officer are included specifically in the administration section. I didn't plan to talk too much about this. I was thinking because that will be something that we can talk about in the personnel committee meeting. But yeah, that'll be the first order of business for that. And then, I took it based on the, I think we took it based on the job description used for Dr. Einhertz when his position was open and he took it last time. The other big thing is that there are a lot of requirements at the end of things like vision requirements, driver's license, which I think we checked with Marcel, and those aren't required, so we took them out. Things like vision and being able to lift a certain number of pounds, which we took out. So, yes. So there you go.
so further updates, we'd like to get the personnel committee back up 4 members. And then we have a meeting tentatively, we're looking at 1 week from today. Engage, and then we expect it to be very intense for
Weeks.
hopefully a couple weeks, but probably a couple months. But anyway, any other questions or comments?
To talk about it. So Bob's last day is it March 31st? Is that the last day?
Yep.
So what the contingency would be that, yeah.
Yep, we're
Okay.
coming up with a contingency plan.
Okay.
We need to gather some more.
Because
info.
obviously we won't have a person in place by then.
Very unlikely, very unlikely.
Okay.
All right, next item on the agenda, under old business, appointments to the Personnel Committee. What I was, so Teresa and Dr. Marker are no longer with us. They were on the committee. So I was thinking it'd be good to just slide Michelle in there as vice president. And then Rob, get your input on that as well, and your connections and contacts, but
As the on the board.
whoever wants to make a motion. or-
I will move for the Personnel Committee to consist of John Lynn, myself, Rob Hayes, and Michelle McLeod.
We have a motion. Do we have a second?
A second.
Any further discussion? All those in favor say aye.
Aye.
Opposed? Same sign. Motion carries. Next item on the agenda is the appointments to the Finance Committee. Again, that was Dr. Marker, myself, Michelle, Heidi, and Kristen. So that was a 5-person committee. We need to replace Dr. Marker if we want to, or continue on with 4, whatever the pleasure of the board. If somebody would like to help out on the Finance Committee.
I guess the one question is it wise to have the vice president on the board?
She's on there.
Oh, she is on there. Okay, okay,
Yep.
great.
It's currently, leave Dr. Marker out. It's me, Michelle, Heidi, and Kristen. Is
Okay, sorry, forgot about that.
Sounds reasonable.
that okay?
That's what
All right.
we've done in the past.
Well, and I mean, eventually there will be another member, and
That's
so it seems like the budget committee tended to have 5 people, so there will be a spot there.
Okay. So nothing at this pleasure of the board at this time is to sit tight.
Yes.
Okay.
So we don't have to make any sort of motion or anything. Nope. Okay.
Next item on the agenda, appointments to the Appeals Committee. Again, that was Dr. Marker, myself, and Teresa. Dr. Marker and Teresa are no longer on the board, so it's just me at the moment. Again, I think it'd be good to have the vice president on there, Michelle. And since it's kind of a legal thing with your background, I think Ellen would be a good choice, but entertain a motion.
I will move to have John Lynn, Michelle Migliori, and myself, Ellen Rylander, on the appeals committee.
We have a motion. Do we have a second?
I'll second.
Any further discussion? All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Board notifications. We have no hirings. We have 1 resignation, Mary Pickens. Any comments, Dr. Fox, on that, or anything we need to know, or?
She's just in school to get her nursing degree and found it challenging to meet the requirements and do school. So she's focusing on school right now.
Okay.
Best of luck to her.
Yeah.
No retirements, no terminations. The next item on the agenda is public comment. So at our regular meetings here, the public is invited to address the board for up to 3 minutes regarding items either posted or not posted on the agenda. Individuals may speak only once during this section of the agenda. Speakers shall properly identify themselves by stating their name and address for the record. Personnel issues are not to be addressed during open sessions of the Board of Health. The board president may interrupt, warn, or terminate any person's statement if the statement becomes personally directed, abusive, obscene, or inflammatory. Also, if there's anybody that didn't sign up that wants to make public comment, please sign up over by Jen desk there.
First one is Taylor Coates.
Taylor?
Taylor Coates, 1519 East Ewing Avenue. New Coates, I'm getting used to it. Changed my name this week. So as a community member, I appreciate when you said that the role of the board is to be an advocate for the community. I think in this day and age, it's even more than always being an advocate for staff or health officers or whoever else or commissioners. It's making sure that the people not only in this room, but outside in the community are safe, that they feel like they're being met. And when they aren't, and they're concerned, that it is your responsibility then to bring those up. So going to the commissioners or the county council meeting, I think that's fantastic. I hope and ask that you advocate, speak up, say something when there are questions that are concerning, like the vector programs or FEMA or any other program that we have that is vital to our community's well-being that might get cut or tabled. I also want to bring up the concept here of representation. You know, I appreciate you going around and saying who you are, and what you bring to the table, and where you're from, and your careers, but you don't actually, most of you don't represent this community. Sorry. This is the room and table I like the least. I don't like seeing this. It's a bunch of white people sitting in a room, making decisions on a community that is varied and diverse, with different socioeconomic backgrounds, different education levels, different races, different religious practices. And so we can't say we're representing this community when it's just one monolithic race. Now, you might have different histories and backgrounds, and I'm not assuming anybody's ACEs score or things like that. I understand those are all very different, and I can't assume what is going on in your household. But something really important is not represented, which is the varied races of our community. And whenever this board has somebody of color, they tend to resign, or there's one and they become the token. And one person of color does not speak for an entire community. One Black person does not then speak for the entire Black community. One Black person does not then speak for the Latinx community or the Asian community or the Pacific Islander community that we have, the Indigenous community that we have here in South Bend, St. Joseph County as a whole. And so it's concerning to me that that is not something that you're also advocating for, that more of these seats are not filled by people who represent this place and have a buy-in, because they don't have Notre Dame degrees. They don't have degrees that get them really good paying jobs. They might be currently on Medicaid, or they might be struggling to get to and from work. They might have transportation issues. I serve on a board, and it's interesting that this is the only board that doesn't have those requirements.
That's 3 minutes. Thank you.
Olivia? So I specifically came from
Could you introduce yourself, please?
Sure.
Name and address.
Sure. Olivia Schneider, 54428 Terrace Lane. I specifically came because of the maternal infant health funding issue. Just here in support of that, because I think the work that the health department is doing regarding to that issue is so important, and I just want to advocate for that and support what they're doing. And I hope that, as you know, as you guys said, that you want to be an advocate for the staff and for the workers in that area. I hope you guys will be an advocate to the county council, because I don't think that, you know, politics or political point should get in the way of doing what's good for our community. I also, you know, I sense from the council, and, you know, maybe this is just me, but I sense a little hesitancy from this board too on the idea of birth equity and working towards birth equity. So maybe this is just me, the sense that I was getting, but I think that birth equity is something that we should all be working towards. You know, by helping to eliminate disparities, we're helping all of us. And so, you know, just because we're focusing on Black and brown moms, those are the ones that are most at risk. That's what the data shows that we need to be focusing on. So I hope that the council, you know, and the board will keep that in mind and advocate for those type of programs. Thank you.
Thank you.
Cynthia Heckman Davis. Cynthia Heckman Davis, MD from Waukegan, Indiana, 125 Gemini Lane. I want to start by saying that how grateful I am for Dr. Bidinger's leading this board over the past several years. There have been some very troubled times. I know of 3 other doctors who lost their lives to COVID, for example. And I want to tell you how much I appreciate your guidance through this board. And congratulations to President Lynn and Vice President Migliore. I've spent the last day and a half at our State House, partly regarding Senate Bill 4, the health initiatives, Governor Holcomb's. This seems to have a lot of bipartisan support. And it will, I think, pass in some form. We don't know the final form that that's going to be. I want to respond to the idea that I've heard and read that our county should opt out of these provisions because of loss of some autonomy from our Department of Health. But that idea actually makes me very sad because it's so misinformed. Our County Board of Health is required by state law to perform core functions. It's required already to report to the state, and it's been doing a very good job of doing that. There isn't going to be any more loss of autonomy than we already have. And on the other side, there are going to be definitely some benefits to this bill. It's a very complex and a lot of moving parts type bill. But one thing that we can expect St. Joe County to have is more funding for some of the core initiatives that are required by law. I don't know about you, but I personally would like to see some of my tax dollars come back to this county to help fund our health. I feel we have a moral imperative, each of us, to be concerned about the well-being of those around us. Thank you.
Thank you. Jenny?
Sally?
I think I wasn't sure I was gonna get to talk about that, so I will.
Okay.
Michelle?
Michelle?
Is it Marcia?
Marcia.
Yes, I'm sorry. I'm excited to speak. If I'm into the wrong thing.
Not speaking.
Okay. Next.
Karen Davis.
Karen Davis, 913 Northside Boulevard. Just a little context. I'm a physician in town, a pediatrician, former board member, actually. Very disappointed to find out about the council's decision yesterday about the funds that were donated for the Chief Birth Equity Conference, which I, as a private community member, was a sponsor of that as well. So I serve on FEMA. And it is quite obvious to me this needs to be advocated for by the board. This money appears to be being held up for other reasons. Birth equity, without a doubt, is an issue. I am a Black mother of Black daughters, and I do not want to see my children die in childbirth. And I'm not sure that people get the seriousness of this problem. You know, it doesn't matter what your education level is, your economic status. If you are a Black mother, you are at risk. So I urge you guys to really support the efforts with the birth equity work that FEMA is doing, that Sally and her team is doing, and to, you know, talk to the council, advocate for that, because as you know, Olivia said so well, that, you know, everyone's health, if we improve the health of our least healthy, it improves the health of our entire community. So I will also echo Taylor as well, that it is disappointing seeing the makeup of the board currently. It does not represent our community. And I think that's extremely important, that you need to have people here who can speak to these issues and give a different perspective of what it's like to be someone else in living day to day in this community. Thank you.
Thank you.
Marla, good night.
My name is Marla Godet. My address is 55705 Sichuan Drive. I live in Osceola. I have 10 scriptures from the King James Version that all speak to equity, 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 to receive the instruction of wisdom, justice, and judgment and equity. Thou shalt understand righteousness and judgment and equity and a good path. And to punish the just is not good, nor to strike princes for equity. The king's strength also loveth judgment. Thou dost establish equity. The judgment is turned away backward, and justice standeth afar off, and truth is fallen in the streets, and equity could not enter. Before the Lord he cometh to judge, and the earth with righteousness shall he judge, and the world and people with equity. You can go on, and people cry Jesus, and they cry Christ, and they cry God, and they say that equity is not real. Equity is of God. We are to love everybody. As a Black woman, I am tired in 2023 of being told no. We worked so hard on that conference. And when people sat at home, me, Sally, and Kelly took phone calls and had to tell people, board members, not other people. We took those calls and told people, we apologize. This was not a place for abortion. This was not a place for those conversations. We were not here for that. No, we did not allow you to bring that to the conference. No, you cannot be a vendor. No, you cannot do that. We took that on, so none of you would have to. And we did it quietly and silently, so nobody would have to. So it wouldn't be in the paper, and we still got dogged out, and money still kept taken away. People are depending on us, but want those meetings. They want somebody to listen to. I'm tired of y'all. Tired of y'all. We will continue on. You're hidden because you won't stop us. There are people dying because of the lack of equity that God told us to have. So all y'all good Christian folks who don't believe in equity, God said you will not stop his people.
Thank you.
Marilyn?
My question, my comments are two parts. First of all, Taylor, I want to support what you said. The board could be a little bit more diverse and represent the city. I can tell by some of your questions and some of your answers, you're missing what the other part of the other segment of South Bend probably would have said or addressed or helped you to understand better and make it clear. So that should be something we take into consideration when, I don't know how someone becomes a board member, but you do need some color on your board, okay? But my main question goes to Sally, because I'm interested in the community cafe. And I'd like to know three things. Number one, what is the goal of the community cafe? Number two, I don't know if you can share your partners with our organization, which is South Bend Reparations Working Group. If you could share your partners with us, because we do some things with you all, and it'd be nice if we could broaden what we're doing in the area of health, diversity. I think that would be beneficial for us. And you mentioned a meeting in January 27th. Is it possible that we can be made aware of when you're having meetings that maybe we can attend and get the word out on what you're doing? Okay, so if you could, those three things. Okay.
Thank you. Anybody else?
That's all done.
All right, next item on the agenda is time and place of next regular meeting will be March 15th at 4:30 here in this 8th floor conference room. Can I get a motion to adjourn?
So moved.
A second?
Second.
All those in favor? Aye. Thank you all.
I made the motion. Now.
Thank you.
Beat me.
She was kind to defer.